Keeping our muscles really strong helps with balance. It helps us be able to deal with uneven ground and maybe prevent the fall from happening. But it also helps with our sense of safety and confidence, so that we're more confident that we're not going to fall. And fear of falling is a really big thing. So doing some strength training, trying to work on our muscle mass and our balance as we get older, and putting in some concerted effort towards that's really, really important. And that's, a simple thing that anybody can do. But of course, there's other things that we can do around that, which is making sure we're regularly touching base with our medical practitioners and asking pointed questions. Are there any medicines that I don't need to be on anymore? Are any of these medicines now putting me at risk of falling as I get into older age? For women specifically, thinking about bone health. So we know that one of the most common injuries after a fall is fractures, and making sure our bones are healthy and able to be resilient when we fall and not fracture is really important. So osteoporosis and anything we can do to try and treat that or look for that, DEXA scans, regular checkups with our GP are really important before, ideally, but once you've had a fracture, definitely making sure that there's no evidence that you have any reason to have a fracture like osteoporosis.
We know that after one fall, people are more at risk of having another, and depending on the injury, that can be quite significant. So a fracture can take up to 6 weeks to heal. So your arm might be in a sling, or you might be required to hop or be in crutches. And then the bone continues to take sort of many weeks to months to get stronger. So it can be one simple fall can result in an injury that takes months to recover from.
Falls aren't always just from standing height, not always in vulnerable people. They're often in people who just make decisions on the fly that unfortunately end up leading towards accidents. And I see a lot of people who suffer higher falls, often from ladders, for example. It's a really important thing to think about. Do you need to be up the ladder in the first place? Could somebody else do that job for you? Do you have the adequate safety equipment around to make sure that you're safe when you go up the ladder? And that, at a minimum, includes somebody holding the ladder for you and checking to make sure that you're safe while you're up. Those are sorts of things that we can do, and all of us make silly decisions when we're in a rush, but just slowing down and imagining that today might be the day that we don't get away with it, and trying to do something to prevent it is a really important thing to try and prevent injuries from falls. So in the most recent data across Australia, over 200,000 people a year are admitted to hospital after a fall, and of those, about 6,000 people die. So the impact of falling, even just after one fall, depending on the injuries that you have, can be extremely life-altering. Sure, some people die of their injuries, but other people are left with debilitating kind of disability that they then have to learn to live with. And every fall that you have sets you back a little bit, and you often don't recover to the level of function that you had before. So we really want to try and get in and prevent the first fall, and definitely after that, any further falls, to stop people having the impact on the way they live their lives.